So there have been a number of studies that have reported numerous benefits of allowing patients access to their visit notes. This has included an improved sense of control over their health care and managing their health care, an improved recall and understanding of their care treatment plan, an improved ability to prepare for the visits ahead of time, and an improved understanding with their medications, including an increase in medication adherence and an understanding of what adverse effects of their medications they should be looking for. Conversely, there have actually been very few reports of any confusion or increased worry in having access to these notes. However, most of these studies have actually been conducted among the adult patient population, where OpenNotes really has been much more widely deployed. Within pediatric institutions, the adoption has been much slower, and we've definitely lagged behind in adopting OpenNotes, likely due to some unique challenges that I'll be discussing shortly. There are, however, some very unique benefits and opportunities for sharing visit notes within the pediatric and adolescent population. Dr. Chetan Sarabhu recently described some of these benefits in a perspective in pediatrics. Essentially, what Dr. pointed out was that care in the pediatric setting often requires the involvement of multiple individuals, which may include parents or other adult caregivers that are involved in the child's care, as well as the patient, him or herself, where it's developmentally appropriate. Access to clinic notes empowers and engages these families by not only giving them access to the visit information, but also allows the information to be appropriately shared among all of the caregivers, especially those who may not have been present at the visit. Additionally, this can also assist in formulating and maintaining a longitudinal medical narrative about the patient. There are some specific patient populations where sharing notes may also be particularly beneficial, and this includes patients with special health care needs, where there's often significant care coordination that is involved. These patients also have very frequent visits and are often seen at multiple sites of care. Providing the notes can help mitigate the risk of fragmentation or incomplete medical information that can be shared among the extended care team. And then lastly, providing notes to the adolescent patient can also help assist him or her in not only understanding his or her medical condition and treatment plans, but also allows them to take ownership of managing their own healthcare needs. And Erin Sullivan will actually talk to us a little bit later in the webinar about her experience around this particular topic. So ultimately, as this graphic really shows, the visit notes really help to synthesize and contextualize all of the health information, including medications, test results, and labs, and allows the patients and families to take the information on their own time, or consume the information on their own time, and then they're also able to control and leverage this information by sharing it with the extended care team. Despite all of these benefits, there are obviously some very unique challenges in pediatrics, which has certainly created significant barriers to the adoption of OpenNotes within this particular patient population. So first of all, there are a number of state laws that are related to adolescents independently seeking care for specific health care conditions or needs, which include reproductive health needs, sexually transmitted illnesses, substance abuse, mental health, and these vary greatly by state. So this, this particular table just to the variation in state laws around reproductive health and doesn't even extend to the variations in local and institutional interpretations of these particular laws. So obviously there's no standardization that can occur around all of these state laws. Ultimately though, the adolescent is seeking this care with the expectation of confidentiality and the expectation that the information will not be shared with a parent or with other caregivers without explicit consent. So this particular information needs to be withheld from the parent's access or from the note so that the parent may not access this particular information. There are also situations in which parents may provide information to the provider that is pertinent to the patient's care with the expectation of confidentiality. This may be information about adoption, misattributed paternity, parental substance abuse, domestic violence, or even the prenatal test results. And the idea is that this information is expected to not be shared with either the adolescent, with another parent, or with both. And then lastly, one of the other really challenging situations that we hear about quite often is the impact on the patient and parent relationship around challenging situations. And these are particular situations around significant disagreements regarding diagnoses or treatment plans, or suspicion of medical child abuse or neglect, where there is a concern that sharing some of the notes may impact the therapeutic relationship that exists between the parent or patient and the provider. The last two, so the information that's provided by the parent with the expectation of confidentiality, and then in particular impact on the patient-parent-provider relationship, are really edge cases. They are infrequent events, but they carry with them high risk. And so those ones in particular tend to be ones that are particularly challenging. These particular situations also do not necessarily have actual legal protections, and this information is often still available if a formal request for health information is made by the family. So even if it's not available in the portal, it may still be available through medical records. So with all of this in mind, we at BCH decided to go forward with OpenNotes in 2014. In terms of a little bit of a history here, in terms of the culture at Boston Children's, we historically had quite a few providers who did send paper copies of visit notes to families. This was very much on a provider-by-provider basis and on a patient-by-patient basis. We did initially make some notes available during a small pilot back in 2006. It was really restricted to a small patient population. We did not have the ability at the time to create confidential notes, so we really hand-selected the patients to make sure that they were appropriate for this particular pilot. Unfortunately, because we were not able to create confidential notes when we then went live with our portal in 2007, the notes were not initially made available in our portal during this initial hospital-wide deployment. So it took a whole 7 years from then to really leverage ambulatory and wide optimization project in 2014, where we first introduced confidential note types for every single ambulatory clinic, with the idea that all non-confidential notes would be automatically released to the patient portal, and the provider could select individual notes where that would not go to the portal. We also retired the process of sending the snail mail for copies to families. So essentially, each provider could do was at the beginning of a visit, or when they were creating their note, they would select either the confidential visit type or the non-confidential visit type, and then complete their note, and upon signing, it would either go to the portal if it was a non-confidential visit, or if it was a confidential visit, note type would not be released to the portal. We then got approval from all of our department chiefs, who were actually quite enthusiastic about the OpenNotes concept, or at least that's what they told us at the time. And we also obtained approval by our legal and compliance team, as well as our health information management director at the time. We created some mandatory education modules for all prescribers in which we described confidential visit information and made sure that everyone was aware of what sorts of information constituted confidential information that should be managed appropriately by selecting the appropriate note type. We also gave some guidance around confidential note creation, and then gave them two options. The option of either single confidential note for individual visits, or splitting the notes where they would have one note with non-confidential information and a note with confidential information. There were obviously pros and cons to each of these approaches. With a single confidential note, all information obviously from that note is restricted and from that visit, which obviously limits the risk of disclosure. But of course, at the same time, this also restricts access to also some of the important non-confidential medical information, and therefore the patients and the parents would lose the benefit of accessing those particular notes. The split notes, of course, allowed access to non-confidential information, so there was still a mechanism to provide this information to the families through the portal, and restricted access to the confidential information. But it also increased the risk of inadvertent disclosure, where, for instance, certain templates could still go into the non-confidential note. And it also fragmented documentation of care within our electronic medical record, making it a little bit more complicated for providers to be able to find all of the information from a certain visit date. We also had individual meetings with some of our high-risk clinics, which included psychiatry, our adolescent program, our gynecology program, our child protection team, and our adolescent substance abuse program. We allowed the high-risk clinics the option to either default to confidential notes or not be part of the initial release. And the clinics at the time asked for initial deferral of the release with an option to do later. I will say that part of the decision around this had to do with some of our technical limitations at the time, where the selection of the confidential note or non-confidential note had to be done at the beginning of documentation. And our providers had some concern that given the high volume of that rotated through the clinics, this would not always be done appropriately. Since then, we've had some changes that have been made to our clinic notes, the ability to actually change the visit type at any point. So we are actually going back to these clinics now to revisit this, and will likely start giving some access to some of some confidential notes. So we went live on January 1st of 2015. We almost immediately saw a significant increase in our monthly user registration numbers right after the release of the OpenNotes. This was likely due to a combination of patients no longer getting these notes by mail. It was also due to some advertisements we did across the hospital, in which we advertised the fact that the notes were now available through the portal. And then lastly, it was also due to a lot of our providers actually who were telling our patients about the notes now being available on the portal, and really encouraging them to start signing up for the portal. We also got some feedback from some of our patients and families, which really touched on a few themes. I'll read you a few of these. For instance, one parent told us that, "I love this feature of being able to use the notes. It typically the visit. It was nice to be able to reference and share with my husband who wasn't able to make the appointment. I appreciate Dr. So-and-so taking the time to write such a detailed update." So this really highlights the need for these notes to be used to share with some of the multiple caretakers, as Dr. Sarabu had mentioned in his perspective. Another quote we got was, "We are so grateful to have the notes to review of a patient's appointments. It is overwhelming as a parent to absorb all of the information at the time of the visit, so the notes are very helpful to review." This really gets to the point that a lot of our communication is verbal, and it is often difficult for a single person to remember all of that information in a very chaotic situation and in a very short period of time. So the notes, again, provide additional support for a parent to be able to review all of that information. Then lastly, another quote we got: "I greatly appreciate the level of detail and thought put into these notes. I realize this takes a lot of time, and I'm so grateful for that time. The notes accurately reflect my concerns and show you really listened, as well as provided concrete steps for a path forward and reassurance." I think this, again, a theme that provides some validation in terms of and trust in terms of what the information that was communicated that the information was communicated appropriately and really reflects the concerns of the patient and the parent. Inversely, we also wanted to know whether or not the confidential notes were really being used appropriately. So we did a few analyses taking a look at really how often people were using confidential notes and flagging confidential information, and why people were really using those notes. So first of all, what we really looked at was really which clinics were most often flagging notes as confidential. Obviously, 2 of our clinics that were excluded from our initial Go Live Adolescent and Gynecology had a huge percentage of their notes flagged as confidential, partly because we defaulted those clinics to confidential notes. But then we really had a host of other clinics that also used confidential notes with some regularity. I'll say that every single clinic has availed themselves of at least once of a confidential note. Next slide, please. We also broke it down across age groups and really found that our providers were using confidential notes for all age groups, including patients under 13, adolescents, as well as some of our young adults. And that varied a little bit by clinic. So then Dr. Chase Parsons, as part of his fellowship project, took a look at a selection of confidential notes and really to determine why it was that people were looking at or using the confidential note type. So we looked at about a year's worth of clinic notes and found that and we excluded the clinics that were automatically excluded from sharing notes. And we also only looked at patients under the age of 18, so excluded our young adults from this particular analysis. We found that about a little over 2% of all of the notes were flagged as confidential of the review of about 1,100 notes that we did. And we found that about 6% of them actually contained actual sensitive information. We found that about 26% had information that screened for confidential information, though the answers to those to that screening questions were negative. We found about 16% of the notes that we could not determine based on our review of the information, and could not find anything within the note that would fit our categories of what we would consider confidential. I will say there were probably less than 5 providers that we came across who would systematically use confidential notes for every single one of their notes. So it was a very small minority across our entire enterprise. We looked at exactly why it was that they were being, with the 60% or so that were actually flagged as sensitive. We found that the vast majority of them were around behavioral health and mental issues. So even though our psychiatry clinic was excluded from sharing their notes through the portal, we actually have quite a few multidisciplinary clinics that include psychologists. So a lot of these notes were the psychology notes that were within these multidisciplinary scenarios. We then also found kind of what really aligned with what our previous hypothesis had been, that essentially we found some information that was confidential to patients, which included their substance abuse, some information around sexual or reproductive health, and then information around kind of abusive situations as well. We then also found quite a bit of around information that the parent or guardian had shared with the expectation of confidentiality. In particular, again, this was a lot of this was around mental health, the mental health of the guardian or of another family member that they did not want to have shared with either the patient or with the other parent. And also information, again, around personal or family member substance abuse, issues around sexually transmitted illnesses around the parent, information also around abusive situations, in particular around domestic violence. And then we also found a few situations where there were very complicated social situations. where again, either this information should not be shared with the adolescent or with the other parent. There were a few legal connotations in particular around, again, information where there was suspected medical child abuse or medical child neglect, a fact where there was significant disagreements between the provider and the parent in terms of treatment or diagnosis options. There were some notes that were around patients who are now in our Department of Children's and Youth and Family and Youth. And then we had a few also around misattributed paternity, where that information, the parent did not want to share that information either with the adolescent or the other parent. So ultimately, the lessons learned at Boston Children's was that we really did see a huge increase in registrations and logins following our deployment of OpenNotes, and that continues. We've seen a lot of positive anecdotal feedback from our families. We have not actually heard any negative feedback from either our families or our providers. We do see a wide range of use of confidential notes by clinic, although the overall percentage of notes that are being flagged as confidential are very small. In particular, if you exclude the mental health and behavioral health notes, it's a very small fraction of notes that are actually being flagged as confidential. And then we really had very minimal issues with sharing notes. We really haven't had any inadvertent disclosures that we're aware of. And in general, both the providers and our patients have been, and families have been satisfied with us sharing our clinical notes.